Welcome to your journey of healing with the Healing Podcast, hosted by licensed clinician Monique Owe and co-host Dr. Mohn.
Thank you for tuning into the Healing Podcast. I am your host, Monique Owe, and I'm joined by my lovely co-host here,
Dr. Mohn.
Okay, so today's topic is called The Challenges of Unique Parenting. And what I mean by unique parenting is when a parent may have a child that has special needs. Because I think to parent a child with special needs or children with special needs, you got to be unique about it. You got to do some things differently that you probably can't do with another child, right? Because you got to figure out what will be best for that child. And in this episode, we're going to make it a little bit more personal and we're going to flip it a little bit because I'm going to talk to Dr. Mohn because Dr. Mohn has a unique parenting situation. And in this case, Dr. Mohn, you have a daughter, right?
Yes.
And can you tell me what condition does your daughter have?
So my daughter has cerebral palsy.
Cerebral palsy.
Yeah.
Well, hear me tell you something. I think I've always said that word wrong. I think I know it and I always say it wrong. Cerebral palsy.
Yes.
I know I'm cerebral and I think I've always said it. So cerebral palsy. No. I'm going to go with you. You're the parent. Yeah. So here's what I'm going to say, though. But first, for our listeners out there, we can assume we might know. Anybody can Google. I know that. But from you, Dr. Mohn, what is cerebral palsy?
So simply put, because I am definitely not a medical doctor, simply put, it is a brain injury that occurs at birth. So, if you don't know much about the brain and things. So when babies are born, their blood vessels are really, really small. I mean, microscopic, of course, very, very fragile. And so when they experience trauma while at birth, they can burst easily. And then that's what causes a brain bleed. And so there are 4 grades, 4 being the most severe. And so, I don't know, you'll see some adults or kids who are in wheelchairs who are probably non-responsive, can't move, their muscles are, and limbs are very, very tight. Those are probably a grade 4. And so, some people like a grade 1, you might not even know they're able to walk, talk, and just kind of, do, typical, normal things. They're probably a grade 1. So Tamia was a grade 2.
Okay, so your daughter is a grade 2.
Yes.
So that means it is somewhat physically noticeable that she has a condition,
yes.
But it may not, just by looking, I may not know what condition. I have to ask. I won't know what condition it is by just looking at her. I know there's a condition.
Right. Yes.
Okay.
You'll know if she's walking.
Okay.
But if she's sitting down, you wouldn't be able.
You wouldn't be able to tell. Okay.
Yes.
So you're saying this is an injury that took place at birth, and it's because of a strain on the blood vessels.
Yes.
Okay.
Well, it's just trauma. She went without oxygen.
She went without oxygen. That's what caused it. So lack of oxygen in this case is what caused your daughter's condition.
Yes.
And this was at childbirth. So my question would be, since it was at childbirth, and of course you're the one giving birth.
Yes.
Did you blame yourself?
Oh, absolutely. And to be honest with you, I still do.
You still blame yourself. Okay.
Yeah. I mean, that was, traumatizing. That's my daughter, and I feel I'm very spiritual. So I feel like, God does not make mistakes. But I also feel like he gave me a job to do. It's to bring her to me as a twin. So, to bring her and her sister into this world. And I didn't do that. And I always go back and think about, maybe if I had gone another day, maybe if I had, just withheld, just held on, then it'd be different. So, I'm better now. But I still do. I hold that blame today, and it's something that I'm working on.
Well, I'm glad you're working on it. I can imagine any parent, if their child is suffering from something and they feel like maybe they could have done something to prevent it. I think there's going to be some form of blame, even if it's a fleeting thought. What if I would have did this, and would this have prevented it? And I'm going to just say in that sense, I don't know, some situation, no, it was nothing that you could have done to prevent it. It's just a unfortunate situation that happened, right? That's what any child that has special needs, any parent out there caring for a child with special needs, I think, I know as much as you say, I could have did this.
Yeah.
I don't know, unless we're talking about an issue of addiction and you were using some type of chemical during that time knowingly, like you knew it was once you knew you were pregnant and you kept doing it, maybe you can say I should have changed something. But let's say you didn't know you were pregnant, you were drinking, and you finally found out, oh gosh, but it did cause something within the children. I think it's fetal alcohol syndrome, right? That might have caused it. What could you didn't know what you don't know. But anyway, but going back to cerebral palsy. So basically, this challenge, basically you told us what it is, Dr. Mohn. You told us that you blamed yourself then. You sometimes still blame yourself now, but you're getting better with that. Yeah. So my question would be, since you have a husband, and of course your daughter has a father, regardless if you're married out there or not, there's a father, right? Did it cause disagreements or arguments between the two of you because of this?
No, my husband has definitely been, my rock, in this whole, situation. And, he's protected me from things that he, knew that I probably couldn't take.
Wow.
And he's taken up a lot of, he's just honestly worked as a team. And I think that it just started just because we have twins. So imagine bringing two babies home at the same time. And in the way that which I had him, it was just really, really, traumatic. So he stepped up, and we just created a system, and we still have that system today. We just it just works.
Wow, that's great. I'd love to hear that. I'm glad that, your husband has been a support. I hope anyone that's out there, I think I'm good. I think I'm correct in saying having the support is better than not. I think absolutely. You need that, right? Okay. So let me ask you this. So since you do have a child that has special needs, Dr. Mohn, what are some of those challenges as a parent of a child that has special needs? What are your challenges that you face or have faced?
Oh, goodness. The stares, the questions have been the hardest for me because you just, any parent, whether they have special needs or not, you want to protect your kids. But here it is, you're constantly having to do that. I feel like I'm constantly, having to make sure that she's receiving, the services she needs in school, because there's nothing, although she had a brain bleed, she's in, regular school. She's in a smaller group so that she can have, more time to do more work and think, her work and take tests and things of that nature. But I'm making sure that she gets a quality, education. But at the same time, she's coming home, telling me about, a child asking her, is her legs broken, or, things of that nature. And so to a parent, that's heart wrenching. So, it's hard, just, I'm feeling like I'm always having to protect her.
Yeah, I can understand that has to be the case. Well, before, while we're talking about your daughter, Dr. Mohn, do you mind sharing with our listeners, what is your daughter's name and age? Do you mind sharing that?
Yeah, of course. Her name is Tamia Denise Mohn, and her age is 11. She's 11.
All right. So Tamia Denise Mohn is 11. She's a twin. That's another unique factor anyway, to be a twin. Right? Are they identical twins?
Identical.
And they are identical twins. Look at that.
Yes.
Well, I love it. I think that's a specialty I love anyway. But anyway, I love to see some twins and triplets and quadruplets. But yes. That's a whole nother thing. That's a different story. But anyway, can I ask you, what are your external support systems or any programs in place to help with this condition or to help you be a parent?
Right. So it kind of just evolved. At first, honestly, it was just Babies Can't Wait that came to do, an assessment. And then she got into physical therapy, which, was their recommendation. She got into occupational therapy, which was their recommendation. And so going to those therapy places, they have, bulletin boards where they're giving, parents different just extracurricular activities for kids who, have cerebral palsy or, other type of conditions. So it just kind of evolved from there. Tamia has been a part of, she did a triathlon, I think three years in a row.
Okay.
And it's for special needs. She was awarded a bike, a special needs bike that fits, that's adaptive to her.
Okay.
She's been in dance. There's a special needs dance class.
Okay.
And I honestly just looked it up, just extracurricular activities for special needs. And a whole bunch of things came up.
Okay.
So she's done swimming. There are horseback riding, and so honestly, you're taking your child to therapy. Probably a couple times a week. You see the same parents, you talk, and then it just kind of evolves from there. But also when she goes to she had a physiatry appointment, which is just they work on muscle strengthening and things of that nature. And that was at Children's. Shout out to Children's because they are excellent. They actually gave me just a list of just different things, different camps and things that she could be a part of. So it really just, kind of evolved for us.
Wonderful. So I think so. For those who don't know, if you're not in Georgia or even if you're here, that's Children's Hospital.
Yes.
Which is here in Georgia. And I know every state probably has some type of children's hospital or specialty hospital for children. So we see it all the time, maybe on TV. So I hope you guys can take advantage at least of that. If you don't know where to start, maybe start there and talk to a social worker. Try to get you some resources. So it sounds like, Dr. Mohn, from me hearing you, it sounds like even though there's some unique parenting you have to do there, it seems like you still try to help her to feel as normal like anyone else. She's involved in extracurricular activities just like another child.
Yes. There's
different programs out there just like any other child. She can swim like anyone else. She can do horseback riding, you said. She did dance, a triathlon. So basically her condition didn't have to limit her having childlike experiences.
Right.
And stuff. Okay, well, I like that. Like that. That's wonderful. And let me ask you, as far as those supports, let me go into also closer supports. What about internal supports? Like, how has that been? Have you needed family support or friend support, or how's that been?
Family and friend support has been everything to us. It is definitely important, and I don't think that we would be as successful. Tamia would be as successful if we didn't have, them ready to step in. It really, honestly, we've been really, really blessed because, Tamia's, she has 2 older brothers, but she has a 13-year-old brother. And then, of course, her twin sisters that push her every day. And have since the day she was born. And so they give her something to strive for. And I think that that's been important for us. But just the simple things like the grandparents coming to pick her up, or, me and my husband both work. So, doing those things or showing up at, different events. And, all of that has been important because even with, a lot of times she has to do an intensive therapy. That's going to therapy every day, being there several hours a day. There's not enough time in the world that my job would give us, or drive the job, or my husband, his job would give us. So having those, supports in place as family and friends has really, really helped us over the years.
Well, I think that's great. So I think what I'm hearing is we need a village. In this case, if you have regardless, you need a village, I think, regardless when you're a parent. But I think in this case, especially, you're saying your internal network, your friends and family have been a tremendous support. It's a little easier because you have them. Is that what you're saying? Okay.
Absolutely.
I think, and you mentioned that you guys both work. So I guess what I can say, so if you're wondering out there, can you work with a special needs child or a child that needs unique attention? It is possible.
It is possible.
It is possible. It's challenging, isn't it?
It's challenging.
But it's possible.
Yes.
But I'll get into, even if you can't work, because maybe your child does need 24-hour care and supervision and you do have a home health nurse, it's okay. I think I want to say that it's okay if that's not the case. Maybe you did have to take a long leave of absence and you haven't worked in years to care for your child. Whatever you need to do, I think, for your child to help them be successful is what I think you should do. But if you have to still work because you need to pay the bills and you just can't, as we see, having a village can help. Is that what you're saying? Okay.
Yes.
Okay. So how about this? Let me ask you this. I guess, let me ask you, you mentioned supports and different things. Was it easy to get those supports in place? The external supports, the programs, the things like that. Was that just easy to do? Was it a little challenging to find?
We've definitely run into some challenges, with therapy and things of that nature. There's a big turnover rate when it comes to therapists. So when you're dealing with kids, it's hard for them to trust, so we've had 1 billion therapists, physical therapists, occupational therapists that have, that's worked with Tamia. That's been difficult. She's learned to adjust now and to just trust whoever is working with her at the time. But, and as far as the supports, honestly, the parents that you meet, the people that you meet along this journey they've helped the most because they tell you about just their experiences. Yeah. They give you, how to, like we had to have a 5K. Tamia needed it's called a selective dorsal rhizotomy, which is they'd have to go into your spinal cord and they'd have to cut a piece of bone off, on the outside of your spinal cord and cut some of those cords to help loosen up her limbs. We went and got that done in St. Louis. Well, a lot of kids here in Georgia elect to go to St. Louis because Dr. Park in St. Louis is awesome and has a really good program there. Okay. So, but that's a $30,000 surgery that insurance here doesn't pay for. Wow. So I had a parent helping me, giving me the tips on how to raise the money, and we had a 5K for Tamia. And so, it's just those things that have really helped us along the way.
So there were some challenges to get the support,
yes.
But I guess by you saying communicating and somehow sharing your story, whether it's in the community or with the other parents who are going through this, they may know an idea. In this case, somebody suggested you to do a 5K to raise the money.
Yes.
Okay.
And other things with the 5K we thought would be awesome and cool, and it was. But I think, Monique, you feel alone, and so coming into the same place where you have the person sitting next to you has a child with the same disability, maybe a different grade, but you're able to talk, and you need that.
Yeah, you need the support. Yeah. So you need someone that understands what you're going through, right?
Exactly.
Nowadays, I guess, especially, I think it's a little more easy to have access because there's different social media support groups. Maybe I don't know if you're a part of those, Dr. Mohn, where they might have moms of children with cerebral palsy and things like that, and maybe even you share, if I don't know how much you may share, but sometimes just you'll be surprised who else might know somewhere across the world, oh, you can do this and it might help your child, right? Or across the country, like, you guys can do this and it'll help your child. So having that community, I guess what I'm going to say, I guess you can't be too reserved. You got to be willing to share something.
Yes. Yeah.
To get the help. I guess if you keep it all to yourself and you don't talk to anybody, it might be a little bit more challenging to be that parent.
Yeah.
Okay. How about this? Tell me about this. What happened? You mentioned a surgery that your daughter had to at least face.
Yes.
What are some personal challenges your daughter had to go through or face with this condition?
Oh man, the surgeries have been the worst. Tamia has had a lot of surgeries, from Botox surgeries to getting her kneecaps moved down.
Wow.
Selective dorsal rhizotomy, I explained that one. She has had a hamstring lengthening. She's been cast so many times.
Really?
And she's just 11.
She's just 11. She's had all these surgeries. Wow.
Yes.
Well, she is a trooper. I commend your daughter, Tamia, for just being a trooper. I mean, listen, surgery is not fun. Okay. Mm-hmm. You don't feel it when you sleep, right? But it's a process. If you've never had a surgery, be thankful, because if you've ever had surgery, it's just a process to get ready, the pre-op, the post-op, all that, the recovery. It's just a lot, right? Even if it's a minor one, if they have to put you under anesthesia sometimes, any type, whether it's general or local, it's the getting ready and it's the afterwards. Of course you don't feel it while you're under, but you do got to go through the after effects, right? So I'm sorry that she had to go through that age, but I thank her and admire her for being a trooper. Okay. So tell me about this though. How has your daughter shined?
Oh man, everything about her. And I'm not saying this because she is my daughter, but if you spend a couple minutes with her, she will steal your heart. She has the biggest smile. She is so loving. She is so smart. And I hear that every teacher, every therapist, everyone who come in contact with her, they all say the same thing. She loves school. She loves people. She loves to dance.
Okay.
She's just genuinely caring. If you tell her that you are, getting ready to go to the doctor or you're not feeling well, she's going to make sure that she follows up with you to see how you're doing. She genuinely cares and just loves people. And she's so mature that, when she has her own spiel about when someone asks her about, her disability or what's wrong with her legs, she has this whole spiel that she goes into. Yes, she does. And so I tell my husband, like, she's more mature than I am when it comes to her disability. Like she takes on so much, and I've only seen it affect her. I've seen it affect her, a few times, but she's just so strong.
Okay.
Yeah.
Well, look at that. I love it. So that is the way she shined. But I think you also, you've shared with me, Dr. Mohn, if I can share, how she's I want to do it myself.
Yes.
I want to do this on my own, right? So Tamia, if you hear this, just know your mom, she speaks highly of you. about how you want I want to do this and I want to be able to do it on my own. And I think a challenge you recently faced was her chair, right?
Yes.
I think the airline broke it or something.
Yes.
And she had to go with another type of chair and she didn't like that chair.
No.
So there you have it. You still have a personality, even you have a special needs. Your child still has a personality, right? And it's still going to shine. Like, okay, look, I want to do this. I don't want that one. Yes. Give me my one that belongs to me. So that is definitely how your daughter is shined. So because of how she's shining, and of course, all those wonderful moments, Dr. Mohn, tell me what it's like as a parent when your daughter has those breakthrough moments or those wonderful moments. What is it like for you?
Oh gosh, I cry. My heart and my soul is just, filled because, you don't know what to expect. Every day, every month, every year is different. And so when you see her overcoming these obstacles, just think about it. She didn't walk until she was 7.
Really?
So
wow.
There was a point in me and my husband's, there was a time when we said, you know what, okay, maybe she's never going to walk. So imagine you're thinking that way and then she up and walks.
One day she just walks.
You just can't, you can't hold it.
Wow.
And so we've had a lot of moments. She's broken so many barriers. And so we're babies when it comes to her.
Oh, look at
we
that.
just are.
Look at that. And I think that's a wonderful, wonderful story to share. Thank you, Dr. Mohn, for sharing these things.
Absolutely.
And let me just ask you this before we segue and come back into the ways you can encourage a parent that's going through this. Let me ask you this, I guess, simple question, maybe not. What does your daughter want to do when she grows up? Does she talk about that?
You know what? It changes every week, her and her sister. She wants to be a doctor. She wants to be a therapist like me.
Okay.
She's still discovering, she wants to be a YouTuber. Right now, she has a YouTube channel and she's, wants to taste food. She wants it to be a twin show and she wants to taste food and try products.
Look at that. I mean, these kids got it going on more than I do.
Yes.
Okay.
So it changes every week. So I can't really tell you what it is this week.
Well, what it shows me is that even though she has a special, unique condition, she has desires and goals just like any other child.
Yes.
So for those who believe out there, my child won't be able to be like another child. Yes, they can. It's just going to be different in how they approach it and how it will be, but they still will have those goals and desires, right? Okay, I love it. Well, let's make a little segue here and we'll come back into how you can encourage and help parents who are going through these challenges. Let's make a segue here. Let's go into, you guessed it, the situation. Dr. Mohn, what's our situation for today?
All right. Thank you, Monique. Here is our situation. Dear Healing Podcast, I no longer want to have children and my fiance wants them. We both have no children. We got engaged 9 months ago. The wedding is planned for the end of this year. We used to talk about having a family, but recently I've been feeling like kids are not for me. Don't get me wrong, I love kids. I am a godmother, and I have nieces and nephews, so does my fiance. I love spending time with them. I just feel like I'd rather enjoy life with just my soon-to-be husband. My issue is I am afraid if I tell him I do not want children, he may want to break up with me. Do you think I may lose him if I tell him this before marriage, or should I just keep it to myself and be optimistic that one day I will change my mind? This is hard, but you definitely don't want to start a marriage on secrets, and especially this one. This is a big one. Kids are, big. It doesn't, there are a lot of people out there who don't want kids, and that's fine. But when you are in a relationship with someone who doesn't want to, you decided that you no longer want to have kids, it is imperative that you share that with him. And, at the risk of your own relationship, you may, it might ruin your relationship or it might not. But I think that it should be his choice. It should be his choice in what he wants to do or how he wants to move forward. So I'll leave it at that. Really?
Okay, well, thank you for writing into the Healing Podcast and sharing your situation. What I can say is, yeah, I agree. I don't think you can go into the relationship by lying, by omission. I think you got to be honest. Give him a chance to choose there. Be honest and say it was a desire, but it has changed. Whatever reason it has changed. And see what happens. I think you'd rather do that than go into a relationship that's going to, because of fights and, challenges because of this, that you end up in a divorce or worse, you're just unhappy. So I think be honest is what I can say. Honesty is the best policy. Let them know what's going on. Just be sincere about it. And you never know. He may be okay. He may say, okay, well, I can deal with it. I can just be uncle and godfather, like, from a distance or something. So I hope that helps you, and thank you for sharing your situation. And if you are out there and want to share your situation, please email support@thehealingpodcast.com or go to thehealingpodcast.com and click the contact tab and share your situation there. And special mention to our sponsor for today, healingexpressionsllc.com. If you're in the Atlanta or Georgia area and you're looking for some therapeutic services, go ahead and go to healingexpressionsllc.com and hit the contact tab and see if you can set up an appointment. All right, so back into the topic at hand, which is parenting, the challenges of unique parenting. We are talking to Dr. Mohn today because she has a daughter who does have a unique condition, and that is cerebral palsy. And I like to say the word unique. That's me, everyone. I just think it's unique. I don't like to really criticize. I think it's just different. It is a special condition. I don't think they should be made to feel any different. So that's why I say unique. So if you're offended by that, I'm not trying to minimize or anything. I'm just saying, to me, it's unique because it has special needs, special attention, and different parenting. Anyway, back to this. Let me just ask you, Dr. Mohn, we've talked about your daughter. You shared the ups, the challenges, and things like that, your village. What can you say to a parent or to encourage a parent that is facing what you are facing?
Definitely don't give up. Continue fighting, because what you do every day helps their quality of life. Definitely, you're not alone. Rely on, if you don't have, outside supports that, really rely on the therapists, the doctors. There's so many resources out here. And so just don't give up.
Wonderful. I thank you for sharing that, Dr. Mohn. I want to say this to those who are out there who may have a parenting situation like this. I'm going to say this. Mom or dad, it's okay to cry it out sometimes. I'm pretty sure Dr. Mohn has had many moments where she shed tears. It is okay if it's in private. I think it's okay sometimes if your child sees it too. That doesn't mean you have a flat out breakdown every time in front of your child, but I think sometimes your children need to see that you're human. And you can be honest. It's not that it's not about them, but it's about what they're going through or there are any challenges. It's just a lot sometimes. And then you bounce back because I think they can see that's strength. It's not going to stop you. The tears are not going to stop anything. It's just being human. So if you have a moment like that where you feel like you just need to cry it out, please, I want you to do that. But I also, like Dr. Mohn said, I want you to share what you're going through. Please share with your village, your friends, your family. Family member. Family is who you make it. It doesn't have to be who you're related to. It could be whoever that is, a good friend, a best friend, a close coworker who maybe also understands, so they have the same parenting situation, and you guys can be buddies. The people that you go to these therapy centers with, you do, like Dr. Mohn said, you see the same parents, the same children. You guys form your own bond because you're all watching each other's children grow and go through what they're going through. So I will say that, and please do not feel that your child is any less than any other child. Your child is a unique vessel and a wonderful being. As you can see from hearing about Tamia, she experiences just what every other child does. And I guess she's about to hit teenage years, so she's 11. So, Dr. Mohn, you ready for that?
No, I'm not.
That doesn't mean she's still not going to go through being a teenager, right?
Yes.
So listen to that challenge. We don't have to hear about that one. But Dr. Mohn, any final thoughts about the challenges of unique parenting?
I just want to, speak to those, do not have many experiences with a special needs child or special needs, even adult, but especially with children. I have run into so many, kids who, we know that oftentimes kids can be cruel. And so I would just ask that if you have a child who's still in school, elementary, middle school, talk to them about, kids who are different from them, the special needs population, because, I feel like it would be so much easier. And not just with Tamia. Tamia comes and tells me stories about other, kids who have special needs different than hers that get, talked about and laughed at. And it's already hard. It's hard already trying to keep up. And so to have, other kids, making fun and things of that nature, simply just because they don't understand, it just makes it harder on us. So I just wanted to add that, Monique.
Well, thank you for sharing that, Dr. Mohn. Dr. Mohn, that's a good reminder. They're carrying a lot, so please educate your children, because don't be cruel. I can't stand bullying and none of that, but anyway, that's a whole nother topic. So thank you, Dr. Mohn, for being open and sharing your situation with us, your parenting situation that you have, and I thank you and Tamia and her father for the wonderful job you guys are doing and that, I know she's going to continue to shine. So let me go ahead and leave you guys with this. Don't try to be perfect. Life isn't. No one is. Use mistakes and mishaps as opportunities to grow tolerance and to teach. There is such a thing as happy accidents, and love, and listen. So I want to say that to the parents out there. I'm not going to say this was a happy accident, but this was an unfortunate situation that occurred at childbirth. But it's no perfection. You guys are continuing to learn. You're growing with your children along with being a parent. And just love each other and listen to each other. And that's how you'll grow and make a good situation for your children. I thank you for tuning into the Healing Podcast. We will talk to you soon. Bye-bye.